I'm Allie Sporleder, Women's Health Ambassador for the St. Francis Gala, and I'm a women's health nurse practitioner at Mosaic Medical Center, Maryville. Well, I got into women's health when I was young in the summers, and I would be at home, not at school, and I was watching TLC, A Baby Story. And that just really inspired me that I really wanted to help with women's birthing process. And so then that led me down the road of wanting to become a nurse. And so then I worked in labor and delivery upstairs here in Maryville for about 5 years before I went down to the clinic to became a women's health nurse practitioner. So I was born in this hospital and, went through K through 12 here. And so it was a no-brainer to come here for women's health because I've lived in Maryville my entire life. But it's just so wonderful to be able to have a team that can really help you through everything. I came here back in the day when Dr. Holman was here and got, birth control, and then, was able to do my gynecological exams. And then when it came time to having a baby, it was very nice to have providers that I could trust, and, know that they were taking care of me the best, because we had a miscarriage. We had a loss for our very first one, and that was tough. And we delivered, I was 13 weeks and we delivered in the hospital up in labor and delivery. And that was, it was tough, but it was very nice to have such caring nurses, and especially the people that I have worked with there with me for that really tough time. And then we had another miscarriage, but that one was pretty early. But it was nice that they were there for me mentally and emotionally in the clinic, my provider, Dr. Holman, to say that, okay, well, let's do testing, let's figure out what's going on. And then kind of a oopsie surprise, and you get pregnant again, and he's 2.5 now. And I delivered him here with Dr. Dodson as a delivering provider. And of course, the labor and delivery nurses that I'd worked with before I became a nurse practitioner. I mean, it was a fantastic birth experience, other than his issues, because he was such a huge baby. He had to have an IV, he had to be glucose monitored and get glucose. And so, of course, that interfered with some breastfeeding things. And then it was fantastic to have Emily up there, even though I was bawling into her shoulder about, maybe having to start on formula and why can't I breastfeed and why do my nipples hurt so bad. But it was just really a fantastic experience. And then we were finally able to go home, and, we're friends with our pediatrician. And he was just a tough baby. And so just having all of those women who've had kids or kind of had that experience to be able to lean on them. And I would have my rotation of texting of like, okay, is this normal? Is this poop supposed to look like this? Like, are my nipples supposed to be cracked for this long? And it was just fantastic. And then we had another miscarriage before my 3-week-old that we have now. And so it was just this cycle of, horrible things were happening, but I had so much support and so much care that I was kind of able to get through it a little bit better. And then, of course, with my 3-week-old, the delivery itself was fantastic. And Dr. Dodson was there, and it was wonderful. But then, of course, she came out and didn't want to breathe for like 15 minutes on her own. And so then, thankfully, we have fantastic nursery nurses, because really here we transition from labor and delivery nurse to nursery nurse to postpartum nurse. And that's what I loved about being here in rural health, is that you just get to see all aspects of obstetrical care. But it was a fantastic job, because they got her resuscitated, and now she's beautiful and fine and breastfeeding great. And I'm still texting Emily about breastfeeding issues, but it's so much easier the second time around. I professionally helped women breastfeed for years, for the 5 years that I was up there as a nurse, and it still did not help me with nursing my babies. I still had horribly pained nipples. I mean, so it's kind of like, you might be so educated and you might know all these things, but there's still this aspect of helplessness as a patient that it's just really nice to have those other nurses there to help care for you. I like to practice in a way that, and I'm sure everyone said this, is very empowering to women. I think that there's a lot of things that women don't know about their bodies, and I want to be here to educate, and I want to do it in a way that they feel comfortable. our patients should really feel comfortable coming to their provider about anything and not feel judged. And so I think that that's the aspect, the point of view that I really like to come and help my patients, is that I'm not here to judge you, I'm here to treat you. And I'm also here to help you learn more about your body and how to take care of your body, whether it's when you're in your child rearing years, or when you're older going through menopause, or if there's a sexual dysfunction in your life. I mean, there's just lots of different aspects of women's health that I think people don't even think about. And that's why in appointments, I'll sit there and ask them the uncomfortable questions that maybe their primary care provider isn't comfortable asking, because they've been with them for their entire lives. Whereas I'm the more directed aspect of care in terms of things that people aren't really generally comfortable with, but I'm obviously very comfortable with, because that's the field that I'm in and that I love to talk about. When you're dealing with women's health, it's more than just having babies and dealing with your periods or trying to prevent having babies. There's a lot to do with, cancer risks and cancer awareness. You have to, check on other things besides just the vulva and vagina. You've got your breast care, you've got your mental health, you've got polycystic ovarian syndrome, and you've got ways that all of those things tie in together when we're talking about, women's health and hormones, or when we're talking about menopause. There's just all these different phases of life that we need to take care of our women. And that's why I love being able to educate and handle and take care of these women, because they may not know about that part of life. They may have just thought that it was, all about having babies, but no, we are here to help you through the entire spectrum of life. There are some aspects of my job that, aren't fun, like babies or, educational, and you do deal more with some sad things, some things that you don't exactly enjoy, telling people, like bad news. But I do enjoy being that provider that can do it in a way that helps support them through the rough time, whether it be a miscarriage or, a likely vulvar cancer diagnosis, or, really generally most of the things that I would see, because some of that harder stuff I'm going to send on to Dr. Dodson for her to manage, as she's the physician and I'm the nurse practitioner. But especially if there's, days where she's not here or it's something urgent, usually it's with a miscarriage, then being through 3 miscarriages myself, and I have 2 children at home, it does help me to be able to relate to them and help them understand, and help me kind of work through some of my loss and emotions left over from that, to know that they're not alone, and you're going to make it through it. For us to be able to build up this community's women's health center and women's health care would just mean a lot to the women of this community, because the closest place to us is, 45 minutes away. When you look up north, there is not a lot of places to want to, first of all, have babies, but second, for a provider to know more specifics about women's health. I mean, yes, we have lots of primary cares everywhere, but it really is going to mean a lot to the women to have other providers, and of course right now we have women, to be able to help take care of their bodies. And to be able to best do that, it's going to be very nice to have a different facility, to have kind of a different feel for the clinic. When you've got women's health clinic next to the primary care clinic, there's just some issues in terms of the logistics of trying to get, these pregnant women away from the sick patients that are coming in, and just for us to be able to move best in our clinic, it's not going to be in with primary care. It's going to be, next to our tools, and like the labor and delivery side of things, obstetrics, mammography, the other aspects of women's health besides just the clinic. It's very nice to just have everybody close together to be able to work and interact better than having one aspect of care clear over here and then the women's clinic clear down here, and we're trying to communicate. It's so much better to just be in closer proximity. My hope for women's health here is that we can get our clinic built up. We, first of all, make it more attractive and more easily accessible, and, more of a comfortable experience for women than what we have right now. But ultimately, we would love to have, more full-time providers to be able to provide care for the women around, because, not everybody's going to get along with a certain provider, and it's nice to have a team and to have different people that can get along. We've got different personalities, but ultimately we would love to have, to add on more providers, to have more, open appointments for patients. I would love to educate them further. It's nice to have more time to talk to the patients, and to do that, you need more providers, more space, more tools. I hope to impact patients to make them feel more educated and more comfortable with their bodies and with themselves. There's been this issue of people wanting to talk about their bodies and feel comfortable with their bodies. But we're entering the day and age now where it's not so taboo anymore, and I'm here to talk about it. I mean, it's one of my favorite things to talk about, are the taboo things for patients, and I want to make them feel more comfortable with it, and I try to impart on them the importance of knowing about their bodies and how to take care of themselves.